Ladies and gentlemen, good afternoon. I'm Steve Scrivanis, Chairman of the Board of University Health. Thanks for being out here today on another rainy and day. Good Lord, I don't guess the rain's ever going to stop. The reason we want to call you here today is to share with you some of the concerns we have about what we see as adverse impact and unintended consequences of a plan by the Willis-Knighton healthcare system to move a base of commercially insured patients from our hospital to Willis-Knighton. The Willis-Knighton plan involves working to move the LSU faculty clinics away from their alignment with University Health to its campuses around the area, which we believe in turn will divert commercially insured patients as well. It's very important that you understand that University Health, as any safety net hospital, depends on its base of commercially insured patients to help it deliver its primary mission of safety net healthcare to the very poorest and most vulnerable people in our community. We believe that the results of this plan would expand Willis-Knighton's already considerable market share to a higher level of monopoly power over healthcare in the Shreveport area and cost patients and taxpayers millions of dollars a year more in healthcare every year. We believe that the consequences of this action is significant. We started some time ago and did a nationwide search to find an expert, a healthcare antitrust attorney, to help us evaluate where we are. To that end, I'm happy to introduce to you David Ettinger, who hails to us from Detroit, Michigan. David is a remarkably talented antitrust lawyer. You can Google him. He's won several significant cases. The most recently one was a landmark decision in St. Alphonsus versus St. Luke's in Boise, Idaho. David has won healthcare antitrust cases both as plaintiffs and defendants. In connection with this work, David has repeatedly been involved in analyses of the implications of hospital competition, healthcare transactions for hospital pricing, cost, and quality. So with that, I'm going to turn this over now to David, and David is going to explain to you and go over a summary report that he did based on the data that's going on in the Shreveport market to where you can better understand our concerns. So with that, I'm happy to introduce David Ettinger.
Thank you.
Thank you, sir.
Good afternoon, everybody. Let me tell you a little bit about what we were asked to do, and then I'll talk about what we did, and I'll take you through our PowerPoint. And you'll get copies of that and some other materials if you like when we're done, and I'll, of course, be happy to answer questions. I was asked by University Health Shreveport to look at this proposed arrangement with Willis-Knighton that would transfer not only physician practices but commercially insured patients to the Willis-Knighton campus, and try to see what it would mean both legally and even more importantly to the community and to the public. And I and my team reviewed hundreds of documents, a lot of documents produced by LSU in response to a public records request. We reviewed lots of economic data, payment data, pricing data. We interviewed many people in the healthcare community, and we came to the conclusions that I'm going to present in a minute. And we are presenting those same conclusions tomorrow to the LSU Board of Supervisors. And this is really, at this stage, an educational process. We want them to understand what, as Steve pointed out, are, I think, unintended consequences of what they're planning to do. LSU is a valued partner of University Health, but we don't think that they quite see everything that's bad that's going to happen from what's planned, and so we want to explain that. My findings have been that if this goes forward, it will be very harmful to patients. It will be very harmful to the taxpayers of Louisiana because it's going to cost the state up to $45 million more. It will be very likely illegal under federal antitrust laws. And so that's what we're going to try to explain today, and I'm just going to launch into the PowerPoint and give you a little more detail on that. So I want to start just by giving you some examples very briefly of what this hospital has accomplished since University Health Shreveport took over the hospital. I'm not going to go into all these points in detail. You'll get the written PowerPoint. But the key point to keep in mind is there's been a remarkable transformation here, enormous improvements, and these are now in jeopardy because of the Willis-Knighton plan. Among other things, waiting times were enormous and they've been reduced by 90%. There have been new programs established. There have been improvements in operating room turnaround, a whole series of things, and the net result is more people are using this hospital, 15% increase in admissions, 30% decline in labor costs, even with the volume increasing, a 43% reduction in patient complaints, lots of major improvements, again, that we are afraid would be in jeopardy if this goes forward. So what is it that we're worried about? There are a series of contracts. Our understanding, based on the public records request, is these are as yet unsigned. We got unsigned copies from LSU that provides that Willis-Knighton is going to have the university physicians provided to it to provide specialty services. And the contracts all have a lot of detailed terms, and these terms are in common, and they say Willis-Knighton will be solely responsible for billing and collecting for these services. That's very important because that means instead of the patients being charged at the LSU rate, the patients, the insurers, the employers will be charged at the Willis-Knighton rate. And that rate is much, much higher, as I'm going to explain. Willis-Knighton will operate these clinics. They'll have all the staff. They will evaluate the physicians. So this business is moving over to Willis-Knighton. And our understanding from everything we have heard from the public records request is the intent is to move the commercially insured patients and leave here the patients that are not as well paid for, Medicare, Medicaid, the indigent. So to take in effect the more profitable patients and move them to Willis-Knighton. And that's the concern. And what's even more concerning is this is part of a broader plan. In January, Willis-Knighton specifically proposed to the governor that it take over management of University Health Shreveport and that all the programs be consolidated into the Willis-Knighton campuses. So we're concerned this is part of an effort at a broader takeover of this hospital, which has done such a great job in the last couple of years of serving patients and improving things. So why is that bad? Well, as I'll explain in more detail in just a minute, Willis-Knighton already has a near monopoly level share in this market. It's got an enormous market share, and this would give it virtually a complete monopoly. Right now, its prices are 50 to 100% higher than the prices of University Health Shreveport. So if a patient is switched over from this hospital to Willis-Knighton, there's going to be a big price increase out of the box for those commercially insured patients, an enormous increase. And it's going to seriously interfere with the mission of this hospital and cause it financial damage. As Steve pointed out, the commercially insured patients, the ones who are covered by Blue Cross and other insurers, those patients generate more revenues for hospitals, and there is no hospital in America that I know of that can survive without those patients, because those patients in part pay for the indigent and the other patients where there's not as much revenues coming in. So it's critical to every hospital. So if those patients are lost, it jeopardizes access to care for the poor and all the other patients in the community. And finally, as we mentioned, this will cost the state up to $45 million, and that means taxpayers up to $45 million, because all those costs that are now being covered by commercially insured patients, the state's going to have to pick up a big chunk of those under its formula. So let me talk a little bit about the specifics. One important thing to note is, and a lot of our information here comes from the LSU physicians, from what we learned in the public records request. LSU physicians said, we think it's preferable to keep the clinical activities at University Health. So this is not being done to improve medical care. And so we got to look at these commercial consequences. Other information from the LSU physicians, the chairs of the departments of the hospital-based physicians, talking about pathology, radiology, anesthesiology, themselves wrote a memo to the dean and the chancellor saying, this is not a good thing because the financial impact will be huge. Patients that will be seen in outside clinics will elect for all their care to be at the outside institution. So this is a problem for the hospital-based physicians. It's an even bigger problem for University Health Shreveport, because what's going to happen is not only are the patients going to see their physician care over at Willis-Knighton, but once they're in a Willis-Knighton clinic, they're going to get admitted for hospitalization at Willis-Knighton instead of University Health Shreveport. And this hospital is going to lose all those critical commercially insured patients. And again, it's not just us saying it, it's the heads of departments of LSU saying it. And this is a big problem, as I said, because we were already in a near monopoly situation. That red, if we look at commercially insured patients, that is Willis-Knighton's share today of the Shreveport commercially insured hospital market. It's already just under 75%. It's already just a little bit away from having a complete monopoly, and this is going to make it worse. Another way to look at this, the Federal Trade Commission and the Department of Justice, as you know, are in charge of antitrust enforcement. And they have an index they apply to say, how bad is a market? When has a market got too much concentration? Shares are too high so that prices are going to go up. And they have a cutoff, a point above which they say there's a presumption of a problem. That cutoff is 2,500 under their index. And I won't go into the details of the index. It's the sum of the squares of the market shares. They think that sums it all up in one number. But the point is, at 2,500, they think there's a problem. Here today, the number is 5,860 in the hospital market. It's already double that. And if what we fear happens will happen, it's going to go all the way up to 7,700. So that's one sign of a huge problem in the hospital market. This is an example of a bunch of the antitrust cases where combinations have been enjoined, have been stopped as illegal, many of them healthcare. And you notice the numbers can be as low as 28 or 30%, some of them in the 40s and 50s. None of them are as high as the 86% that we think would occur here, and yet they were all stopped. So that gives you a further idea of the scope of the problem here. That was on the hospital side. But let's talk about the physician side. The clinics are going to move, the physician practice is going to move. If that commercial business shifts, we calculated what would be the combined market share then that Willis-Knighton would have in those physician specialties. And they range from 50% in ENT all the way to 80% in neurology for commercially insured patients. So these are all numbers that are way too high by recognized standards. Eliminating competition, creating dominance. And these are just some of the initial specialties that are going to move. This is just the beginning of what's going to happen, but you can see how bad that would be. Again, we wanted to compare it to the FTC threshold. When are there problems? And again, in every single physician specialty, the numbers are going to be much higher than that FTC threshold after this occurs. Now, this should not be news to Willis-Knighton, because in 2013, Willis-Knighton decided it could not acquire this hospital. And in doing so, they issued a press release. And what did they say? We determined that costly antitrust challenges would certainly be brought against Willis-Knighton if we added the LSU Medical Center market share to what we already have. So they're agreeing with what we're saying now, but they're trying to do the very same thing through the back door, it appears. And that's the concern. Now, I've been talking about the FTC and the DOJ and about legality. This is about legality, but more importantly, it's about what's going to happen in the market. These concerns are there not because of formulas, they're there because people are hurt when you get monopolies and there's no competition. And so this is what the economic research shows. A lot of people have studied these issues as there have been more hospital mergers around the country. And the economic studies have found overwhelmingly that when you get these high shares, bad things happen. Prices go up dramatically. And these are some examples of the studies. Increases of 30%, 40%, 50% in prices for the understandable reason if there's less competition, the party with the bigger share has more power and they can raise prices successfully. The Blue Cross or other insurers don't have any choice. They have to go there. And so they pay it. And then that gets passed on to the public in the form of higher premiums. Self-insured employers pay it directly. People pay more in their co-pays and deductibles. So that's the harm when you get these big market shares. So we also looked at what are Willis-Knighton's prices today. And what we're able to do, interestingly, University Health Shreveport's own employees use both Willis-Knighton and this hospital. And they go through Blue Cross. So we have that data. So we were able to compare what's paid on an apples-to-apples basis by Blue Cross for those patients who go to Willis-Knighton versus University Health Shreveport, and we found an enormous difference. Here, outpatient claims, 50% higher at Willis-Knighton. Inpatient stays for medical services, 3 times as high for Willis-Knighton. Inpatient stays for surgical care, more than twice as high. Inpatient stays for maternity care, 2.5 times as high. And then we looked at another source, the federal government. So this is not our data, this is the federal government. You can look it up online. The Center for Medicare and Medicaid Studies has data which they compile by DRG, which is specific treatment areas, so they're apples to apples. And they look at every hospital in the country, I believe, in all these categories, and you can look at what the average charges are. And they had enough data to do a comparison for 47 different areas as between University Health and Willis-Knighton. And looking at those 47, what we concluded, averaging them together, simple math, you could do it yourself from the website, Willis-Knighton is twice as expensive. Now these are charges, and not everybody pays charges, but they're a base for what many payers pay, and it's a further indication of the higher prices that will happen tomorrow if somebody shifts over and gets hospital care at Willis-Knighton instead of University Health. As I'm saying, if Willis-Knighton gets a bigger share, it will have more power, and the antitrust scholarship says the prices will go up even more. There'll be even more harm. The harm is not limited to price, it's also an issue of quality. And the economic studies have found, not surprisingly, that when you get less competition, quality suffers too. There's not that competitive impetus to try to do better than the next guy and therefore provide better quality. And so it can harm patient quality as well. So to summarize, there are a whole series of problems we see if this goes forward. Higher cost to the taxpayers, up to $45 million, higher prices, cutting into the ability of this hospital to protect the poor, reduce choice, and finally it'll move Shreveport further towards a healthcare monopoly. Let me just add one other point and then just to tell you about the information that's available. I think Steve mentioned my St. Al's versus St. Luke's case. That was not on the chart, but it's worth mentioning. If you want to learn more by looking in depth at a particular case, that might be the best example. In that case, the dominant hospital in Boise, Idaho bought the largest physician practice. My client and I sued to stop it. We were joined by the Federal Trade Commission. The transaction was found illegal, and that was affirmed in the Court of Appeals, and that's being looked at as kind of a leading case in this area now. Decisions just came out in the last year or two. Interestingly, Willis-Knighton's share of the hospital market is much higher than the defendant's share in that case, where the practices were found illegal. So if you want to research further, that's a good place to look. If you Google St. Alphonsus versus St. Luke's, you'll get lots of things to read. So that's a summary of our conclusions. There's also a more detailed report if you want it, and we'll be presenting all this tomorrow to LSU, and we hope that it'll be informative. That's basically my presentation, but I'm more than happy to answer questions.
I'm curious to know how this all came about in the first place.
I mean, how did LSU and Willis-Knighton decide to do this?
Yeah, where did the idea for this plan to even take effect?
I don't know. You'll have to ask them.
Do we know which clinics are going over to WK?
We have, through the public records request, we have found contracts for clinics for 17 different specialties. We don't, and our assumption is, based on the apparent plan to move all commercially insured business, that that's just the beginning. But we do have those 17 identified through their contracts, and some of them were identified in that market share chart that I showed you a few minutes ago.
And there are how many specialties total?
I don't know what the exact total number is. My impression is that the ones that are geared to go over shortly might represent half of the business, maybe a little less. But we haven't tried to estimate that exactly.
What records did y'all ask for to glean this information?
I can't tell you off the top of my head what the precise public records request was, but it related to this subject. We asked for all documents relating to this subject and received quite a few documents.
Do these contracts need to be approved by the state before it would all happen?
Jessica, that's not clear. I'm not certain who has the ultimate authority to make that decision. So that's not in our court. So.
How far along are these agreements with Willis-Knighton?
Well, we received in the public records request what appear to be final looking agreements that are unsigned. That's all we can tell you.
And you believe they were just...
How did you come up with the figure that it would cost taxpayers $45 million more if these services are shifted?
Well, if we lose the commercially insured patients, there's a calculation using Medicare cost to charge ratios that indicate which costs the state would be responsible for, and one of our consultants performed that calculation. And if all that business shifts, it'll be $45 million. If not all of it does, the number will be somewhat less.
You feel you were being left in the dark about this and that it would just be sprung on you when it was signed?
I don't have any comment on that, but now that it's all available to us, we're doing what we can to educate everyone about the impact of what could happen.
But this is something.
How many separate contracts are there?
We found 17 in the public records request.
And this is something you had to request through FOIA request that your partners, LSU, did not give over to you willingly.
That is correct.
Are these packs that the LSU board can stop, or are they between the, I guess, the medical or the practices, LSU practices?
Well, I can't really be certain of that, and I'm not certain that all those contracts that we found, which have been executed, which is not. The intent to move the clinics is clear. How far along it is in that process and who is in responsible charge for approving that, I don't know. That's an LSU issue, not a university health issue.
I mean, we would certainly hope that the Board of Supervisors has the power to stop this, and we hope they will.
There are 4 heads of departments that already have clinics over at WK, right? So is this like in addition to Dr. Nanda, Dr. Gali, those 4, those 17, are those in addition to that?
It's in addition to that, right?
Yes.
And you mentioned the $45 million.
Hi, this is Eileen McDonald at Sears. I have a question, because I've been following the St. Alfonso, St. Luke's case, and I know with the FTC that they're often now waiting for these mergers to happen before then they file a suit or inquiry into this. So if tomorrow you're not successful in this educational attempt, what's the next step? And will the damage already be done if they move forward? And even if you do a legal action with St. Luke's, they still haven't unwound the Salzer group.
Well, I can tell you a lot about the Salzer Group issue, but in terms of the situation here, we're focused on this educational effort. If that does not succeed, we'll have to evaluate our options. No decision has been made. I will say, our understanding is, and our information is not perfect, that these doctors will not be moving over to these clinics for at least a few more weeks. So this has not yet happened.
And I believe this has been the first time that the implications and the unintended consequences of all of this have been fully vetted and understood on both an economic level to the state and on an antitrust issue. Certainly as we began the process, I understand a great deal more, as does our board, about what's involved here. And I suspect the general public as well will also weigh in on this. So,
Is this something that the doctors know about already?
they're being told right now, as a matter of fact. So, we had our board meeting, and then we're just going up having a press conference to keep it all in the right order.
I just want to make sure for clarity, so we understand this is LSU and Willis-Knighton talking about taking the commercially insured patients from University Health.
Yes, yes.
Well, the way this will work is LSU's doctors, so a certain portion of them will practice at Willis-Knighton clinics. We understand that the plan is that they will treat their commercially insured patients then at the Willis-Knighton clinics. In terms of hospital care, it's always the option of the doctor what hospital to refer their patient to. But we think the expectation is, and we think this is consistent with how Willis-Knighton has always operated, that once those doctors are on the Willis-Knighton campus, they will be referring to Willis-Knighton hospitals. And so, that's how the patients will shift, both doctor and hospital. That will be the effect through the mechanism I just described.
Right. So it's and just because I get the names of the two organizations mixed up sometimes, LSU Hospital has been in talks with Willis-Knighton.
Well, the LSU, we're talking about the LSU faculty,
Gotcha.
the physicians. The hospital here is University Health Shreveport. Okay.
You mentioned that you felt like this would be illegal. What was the basis for that?
Well, you saw those market shares in those FTC charts. I think when you have these kinds of shares and you combine them and get even larger shares, the presumption under the antitrust laws is that that is illegal, absent some strong argument to the contrary. I don't know of any strong arguments to the contrary. I think when you've got somebody, in fact, there are several reasons here to believe that the problem is even greater than the market shares would indicate. Number one, you've got Willis-Knighton that has made a series of acquisitions of physician practices over the years, so this is not the first. Number two, you would be taking patients from the low-price competitor, University Health Shreveport, and moving them to the high-price competitor. That's harmful to the public. So under those circumstances, the case law says that transactions that meet those circumstances are very likely illegal.
Can this hospital survive without commercial care patients?
Well, I don't know, survive is not the right word. I don't know that we could thrive. But the point is, it's going to increase the cost of the state because when we take away the component that our insured patients have that goes to help us defray the cost of indigent expense, that cost is backfilled by the state because it is the state's responsibility to pay for indigent care. It's our job to do it as efficiently as possible. And so if we lose our commercial patients, then the cost to the state is increased. And that's the unintended consequence that I don't think most people fully appreciate.
Is there a way to file some sort of antitrust complaint before the contracts are all done?
As a theoretical matter, yes, but as I say, right now we're focused on the educational effort, and that's all for the moment.
It remains my hope that through the educational process that everyone will come together and understand that this is not the best move for the hospital. It's not the best move for the partnership. It's not the best move for the taxpayers in the state of Louisiana, and that it's not the best move for the citizens of the Shreveport area, both for the physicians and the patients. So again, this process is meant to be educational. Well, everyone will understand the implications of what's going on to where we can move forward together as we planned at the outset.
Would this move endanger anyone of violating Stark laws?
I don't think I want to offer an opinion on that one way or the other.
All right, any other questions?